When it hurts to pass stool and you notice blood in the toilet, many people ignore the problem for a long time without seeing a doctor. I have seen many patients do this because they feel embarrassed to talk about it. But staying silent can allow the condition to become more serious over time. In this video, I will explain the causes and treatment in very simple language so you can clearly understand what may be happening. First, let's talk about the anus, which is the opening where stool leaves the body. Normally, this opening stays closed and only opens when you need to pass stool. Several structures help keep it closed, and one of the most important is the anal cushion. These cushions are soft tissue structures that press from three sides to help seal the anus. When these cushions become swollen, bleed, or slip downward and form a lump around the anus, the condition is known as piles, also called hemorrhoids. Hemorrhoids can cause several symptoms. One common sign is bright red blood with stool. You may notice drops of blood on the toilet paper or red stains in the toilet pan. The blood appears bright red because it comes from the lower end of the anal passage and has not had time to clot. By contrast, if bleeding comes from higher up in the digestive tract, such as the stomach or intestines, the blood changes color as it travels through the body. In that case, the stool may look black and tar-like, and this requires urgent medical attention. Another symptom is swelling that comes out through the anus, which may feel like a soft lump. This often happens after passing stool. Sometimes the lump goes back inside on its own, and sometimes it has to be pushed back in with a finger. In more advanced cases, it may no longer go back in at all. Many people also worry about pain. Hemorrhoids do not usually cause severe pain, but sometimes they can. For example, if a swollen lump becomes trapped outside the anus and its blood supply is reduced, it can cause intense pain. This pain is often worst for 1 to 2 days. If you have severe pain, you should speak to a doctor. If you cannot see a doctor immediately, there are some home measures that may help reduce the discomfort, along with any treatment your doctor recommends. Other symptoms may include itching around the anus, mucus or slimy discharge, and a feeling that the bowel has not fully emptied even after passing stool. Now let's talk about treatment. A very important part of hemorrhoid treatment is preventing constipation and keeping the stool soft. One commonly used remedy is ispahula husk, also known as psyllium husk. Many people know about it, but not everyone knows how to use it properly. It should be mixed with the amount of water recommended on the packet until the drink looks clear or slightly cloudy, and then taken immediately. It should not be mixed and left standing. It is usually taken twice a day, often after meals. While taking it, you should drink at least 2 liters of water a day. Without enough water, it can sometimes cause blockage in the throat or intestines, which can be dangerous. It is also important to know when it should not be taken. It should not be taken right before going to bed because this may increase the risk of bowel blockage. You should also avoid it if you have abdominal pain, nausea, vomiting, narrowing or blockage in the bowel, a previous bad reaction to psyllium, a sudden change in bowel habits lasting more than 2 weeks, unexplained rectal bleeding, or certain bowel conditions that weaken intestinal movement unless a doctor advises it. It is a medicine and it can have side effects, including diarrhea. If constipation does not improve after 3 days of use, you should consult a doctor. For pain relief, paracetamol can be used. Other medicines and ointments may also help, but they should be used according to a doctor's advice. Some painkillers should be avoided. Tramadol, for example, can cause constipation, which may make hemorrhoids worse. Some combination painkillers contain both tramadol and paracetamol, so these should also be avoided. Ibuprofen should be avoided if bleeding is present because it can increase the risk of bleeding. Here are 10 home care tips that can help reduce pain and improve symptoms in addition to medicine. Sitting in warm water can soothe the area. A warm sitz bath, taken up to 3 times a day, may be especially helpful. New mothers who develop anal pain after childbirth are often advised to do this as well. They may also feel more comfortable sitting on a soft cushion. You can also wrap ice in a towel and gently apply it to the painful area for short periods. Lying down with your legs slightly raised may help reduce pressure and improve blood flow. You can place a pillow under your feet or slightly raise one end of the bed. Keep the anal area clean and dry. After passing stool, avoid harsh wiping. Instead, you can gently clean the area with slightly damp toilet paper. Do not strain too much when passing stool. Do not sit on the toilet longer than necessary. Avoid using your phone, reading, or doing other activities while sitting there. Do not hold in stool when you feel the urge to go. Delaying bowel movements can make stool harder and more difficult to pass. To prevent constipation, make sure your diet contains enough fiber and drink plenty of water. These two steps often improve constipation within a few days, and hemorrhoid symptoms may begin to settle within a few weeks. A high-fiber diet maintained for about 6 weeks can reduce bleeding in many patients with hemorrhoids. Regular physical activity is also helpful. You do not need intense exercise. Even simple activities like walking, light stretching, or yoga can improve bowel movement and reduce constipation. You can begin with 20 minutes of walking a day, 3 days a week, and then gradually increase to 5 days a week. If you are overweight, losing weight may also help reduce symptoms. You should consult a doctor if there is no improvement after 7 days of home treatment, if the problem keeps coming back, or if you are over 55 and develop these symptoms for the first time. You should go to the hospital immediately if pus comes from the area, if you have high fever or chills, if you feel very unwell, if the bleeding is continuous, if you are passing a large amount of blood, if the pain is severe, or if your stool is black and tar-like. Take care of yourself and stay safe.